The truth of the matter is that I was a very young student at Highlands North High School, totally out of my age group actually. I didn't really have any idea of what professional course I wanted to follow at university. All I did was achieve academically and nothing else really. Socially I was disadvantaged. I had a poor self-image with the rest of the pupils, and quite frankly I found life at school very, very tough. So with the advice of my parents and myself, because I was good at maths and applied maths, I decided to apply for a Bachelor of Science degree at Wits University and enrolled for this. And then all of a sudden, in our final year of matric, my attitude changed when our science teacher, who was a very experimental fellow, happened to blow up the west wing of Highlands North High School in a chemistry experiment. And then I really was impressed by this. Every time I saw the scar on his face, I remembered that this was real living science. And I decided I would apply for a chemistry BSc. It was very coincidental. One evening in, I think it was late September 1953, my late uncle had a cerebral hemorrhage. And we went along to the hospital and we spent nights over there watching doctors trying to save his life, trying to resuscitate him. And all of a sudden, I turned around and said to my dad, I was suddenly filled with the desire to help my fellow human being, particularly someone in need, not only in the medical field, but in every field. And I knew what my life's work would then be. It was almost as if I'd been sent a message. I suddenly said to my late father, Dad, I know what I want to do. I want to become a doctor. That's how it all started. At the time of me going to medical school, my dad said to me, and he was always one who believed that we should do things for ourselves and not be supported in these things by parents. If we wanted anything, we had to get it ourselves. And he simply said to me, my boy, go along to the university, speak to the registrar, get them to change your application from a Bachelor of Science degree in chemistry to a degree in medicine, and everything will be all right. It was famous last words. I arrived at the university to meet the registrar of the university. He was an extremely charming man who said to me, I'm terribly sorry, Mr. Kussel, but this is now 1953, the end of 1953. The applications for medicine had to be in at the beginning of 1953. So that in 1954 you could then start your course and register for medicine. Unfortunately, we've had hundreds of applications. There is no way we can change the application now. And you will just have to go home, apply for next year, and I'm sure on your academic record you will get into medical school. I remember saying to him, if you can't help me, then who then can help me? And he told me that I should go up to the medical school itself, which was in Hospital Hill, and speak to the secretary, the registrar of medical school, who was also the dean's secretary. When I arrived over there, the dean's secretary was not as helpful as the registrar at the university. She simply said to me, and I'll quote her words, take yourself home, young man, and do as you are told, and apply next year. Well, I didn't accept this either. I realized I was in the dean's office, and it was now make or break. So I sat down in one of the chairs in the waiting room, and I said, I'll wait to speak to the dean myself. She thought I was crazy. But anyway, as fate would have it, the dean walked in about 10 minutes later, and he must have asked her what I was doing there and what I was there for. And to my astonishment, he then put everything aside and said to me, "Mr. Kussel, come into my office and tell me your story." I did just that. And to my greater astonishment, after about 10 or 15 minutes, he turned round to me and said, "Mr. Kussel, if you can bring me 2 references, one from your school principal and one from a fellow professional, in medicine, within the next 24 hours, because the Senate meeting is in 2 days' time, I will put your application forward." The rest is history. The application was put forward, and I was accepted to study MB-CHB at Wits University. I chose Wits Medical School because I knew of no other university. I was also seriously financially constrained. Never had any motor cars, went to school on my 2 feet and then a bicycle, and really financially constrained, and could never contemplate the expense of studying anywhere else. Wits also has and still has the reputation of being one of the finest universities in the world, proven by the people who graduated and continue to graduate from there. Just to name a few of these people of my era: Professor Sidney Brenner, Nobel Prize winner in physics; Professor Raymond Dart, the most eminent anatomist in the world to date; Professor Philip Tobias, similarly; Professor James Geer, co-founder with Jonas Salk of the polio vaccine; and not to mention our own class of 1960. 4 deans of medicine in medical schools, 3 in the United States, 1 in Australia; 2 of the foremost medical geneticists and professors of genetic engineering in both London and America. The environment at medical school was a highly competitive, success-driven environment, and this, together with the outstanding teaching we received at the medical school in all our years of study, motivated many of us to become the achievers that we became. The first patient I lost in life was a man that had an incurable condition of his heart. He had bacterial endocarditis, and my head of the department, who's in whose ward I was looking after this patient, said to me, "Kussel, this patient is not going to make it." I thought Kussel was now the greatest doctor on earth. He'd graduated, he'd qualified, and I made up my mind that this patient was going to make it. For 6 weeks, I sat by his bedside, playing chess with him, and after about 6 weeks, he said to me, "Dr. Kussel," he was calling me Jack at that time, "don't you think I can get up to the toilet and go to the toilet? I've been in bed for 6 weeks." I said, "I'm sure it'll be all right. It's 6 weeks that you've been in bed. Just get up to the toilet, let the nurse help you, put you in a wheelchair and go to the toilet and you'll be fine." I arrived home after about 10 minutes to a call from the nurse in the ward to say that Mr. X had dropped dead in the toilet. And that was my first lesson in life, that we don't save lives, we're merely instruments to save lives. And any doctor that thinks he saves a life is sadly disillusioned. It brought this chilling message home to me with a tremendous impact. It was one of my first weeks as a houseman. my first month or 2 months as a houseman. So it changed my perception of medicine totally. Here I was, this great student that had qualified, that had got through 6 years of medicine without failing, with one of the finest medical classes that the university has ever seen. First of all, you were dealing with emotions, with families. You were dealing with life itself. You weren't dealing with the laboratory. You were dealing with people that had lost loved ones. And that was the first big impact on one's life. I never practiced anywhere else in the world. I attended several medical congresses, innumerable medical congresses, and each medical congress that I went to convinced me of how not up to date the medicine was in the rest of the world. One classic case was in America, where a professor who was most prominent neonatal pediatrician in the world at that time, was busy having a ward round. And I had the honor of being invited to his ward round with about 40 other people. And I couldn't believe my eyes when he started presenting his first case. Hi, doctors. This place is the most voluminous facility in the whole west of America. We have 36 babies here on ventilators, and this particular baby is a problem in diagnosis. The baby was lying there with tubes all over his chest. He was having pneumothoraces in his lungs, and I couldn't actually believe my eyes that he was telling me that it was a problem in diagnosis. So I let him go on talking. He said, "Well, what do you all think?" So I waited for one or two people to speak. We go down to X-ray. I said, "Come down to X-ray," to him. And I said, "Put up these 80 X-rays that you've taken of this baby." And as he put up the first 2 or 3 X-rays, the cysts in the lung were obvious. The baby had an infection of the lung, either Klebsiella or Haemophilus or staph. And I said this to him. I said, "Have these steps been done?" "Staph, doctor, where do you come from?" See? I said, "I come from South Africa." "In Africa you might see staph, but we don't see staph in the States." So I said, "Well, may I suggest to you, respectfully, that you send off swabs on the baby." The baby did in fact have staph, and the baby has now survived. I have worked only in South Africa. I'm proud that I've worked only in South Africa. I was offered the professorship over there. I was offered also a professorship in Israel to start a neonatal unit for them. I declined both of them because I loved the medicine we practiced here. Contrary to many opinions, we still enjoy a top spot in the world as far as pediatrics is concerned and general medicine is concerned, especially clinical medicine. We haven't continued to have a clinical training in this country which is equal to, certainly, and if not exceeding, most of the other universities in the world. They do not have our clinical material, they do not have our expertise, they do not have anything like this. They do not have this diversity of population which we have, which enables us to practice medicine properly. I encountered the late President Mandela through the Mandela family, whose pediatrician I became when the late Zinzi Mandela gave birth to a baby. This marked the beginning of a lifelong relationship to the whole Mandela family. I remember sitting in the guest enclosure at the inauguration, almost as a déjà vu phenomenon, watching that life-changing fly past of planes that made one so proud to be South African. I will also never forget the personal kindness that Madiba showed to ourselves as a family by attending my daughter's wedding, walking with the wedding procession at the head of the procession and sitting amongst our family and friends in a very moving ceremony. Another unforgettable moment when our children and grandchildren were given the honour on several occasions, because I have a very large family, they couldn't all fit in at the same time, of privately meeting with Madiba at his home in Houghton. Follow your own guidelines. Don't be tempted by mercenary dealings, and this now applies to every one of us in South Africa. We've become a very mercenary society. You know, all we think of is the number of patients some of us can see in an afternoon and the amount of money we can rake in. It doesn't apply to that. It applies to the number of people you can help and the number of lives you can touch and the number of people that you can be of service to. I always used to enjoy in my rooms seeing people of various diverse population groups and saying to my receptionists, these people cannot afford it. Please don't charge them. And if they are embarrassed, just charge them a nominal fee. Always. You've got to encourage the youth to play a more active role in society. And you can only do that if you educate the youth. Education is the first priority. If you make that your first priority, not anything else, educate the youth.